Bunions and calluses. Introduction. Bunions typically affect the joint that connects the big toe to the foot. Select true or false. Correct. The joint that connects the big toe to the foot is known as a metatarsophalangeal joint. Bunions typically affect this joint. The most common cause of a bunion is tight-fitting shoes. Select true or false. Correct. Which one of the following conditions is more likely to be painful? Choose one of the following options. 1. Calluses. 2. Bursitis. Correct. Calluses usually do not cause pain. They are thickened skin that can develop on top of bunions from repeated rubbing. A bunion can be painful. It can cause bursitis, a painful inflammation of the bursa. Which of the following is a risk factor for developing bunions? Choose one of the following options. 1. Family history of bunions. 2. Wearing narrow shoes. 3. Rolling your foot inward as you walk. 4. All of the above. Correct. There are many risk factors for developing bunions and calluses. Is surgery the only way to treat a bunion? Select yes or no. Correct. Home treatments can successfully treat some bunions. Bunions may cause chronic foot pain if not treated. Select true or false. Correct. Untreated bunions may also cause foot stiffness or a foot deformity. Thank you for using Explain.